Thalassemia. What is thalassemia? It's a common genetic disorder that causes your body to have less hemoglobin. Thalassemia is a rare inherited disorder where your red blood cells are carrying less oxygen than they're supposed to. Most adult hemoglobin is composed of 4 protein chains, A plus B plus B plus B. And 2 main types of thalassemia patients have defects in either of the A or B globin chain. After hearing us talk about hemoglobin, you're probably wondering what that is. It's a protein in your red blood cells that transports oxygen to your organs and turns it into carbon dioxide. There's 2 types of proteins in hemoglobin. There's alpha and beta. Some organizations that are helping patients with thalassemia and are looking for cures are Cooley's Anemia Foundation. They are working their best to try and find a cure that can cure severe cases. Mild cases require a bigger dose of vitamins and a possible stem cell transplant.
Stem cell transplant is usually derived from bone marrow, peripheral blood, or umbilical cord blood in order to replicate inside of a patient and to produce additional normal blood cells.
How can you get thalassemia? You can get thalassemia by having a problem in your DNA mutation. You can have a DNA mutation malfunction. If your mom or dad is a carrier or have thalassemia, it means that you will be a carrier, or you will possibly have it. There is a 97% chance that you will be a carrier of thalassemia if your parents are carriers of it or have it.
Here are some frequently asked questions about thalassemia. 1. How do you get thalassemia? The answer is that thalassemia is caused by mutations in the DNA of cells that make hemoglobin. 2. What are the treatments for thalassemia? The answer is the doctors use 3 methods for severe to moderate cases. Those include blood transfusions, iron chelation therapy, and folic acid supplements. 3. What are the symptoms of thalassemia? The answer is some symptoms can include dark urine, fatigue, weakness, pale or yellowish skin, facial bone deformities, and abdominal swelling. 4. What is a day in the life? The answer is that thalassemia can cause anemia, leaving you feeling fatigued. 5. How are you diagnosed? The answer is that you are diagnosed through blood tests. And what is the life expectancy with someone that has thalassemia? The answer is that doctors expect a normal life expectancy. The different pictures of red blood cells represent different types of thalassemia. A and B represent when there are holes in your red blood cells. E and C represent when your blood cells are elongated. B and E represents when your red blood cells are destroying themselves.
Here are 2 examples of people with thalassemia. The woman in the right corner has a beta case of thalassemia, which means it's much more noticeable and a much more severe case. The baby in the left corner has a very slight case of thalassemia, which is considered alpha.